Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. If you visit the birthing center at San Juan Regional Medical Center in Farmington, you won't see an infant room with tightly swaddled babies in rows of glass cribs. Instead, you'll find newborn infants in rooms with their mamas and papas, and quite possibly grandmas, grandpas, and siblings too. San Juan Regional Medical Center recently received certification as a baby-friendly hospital by Baby Friendly USA, an accrediting authority for the Baby Friendly Hospital Initiative established by the World Health Organization and UNICEF in 1991. The initiative encourages breastfeeding as a first choice for infants and establishes evidence-based protocols for hospitals and birthing centers to help families bond with their babies and learn to care for them before they head home. It starts with breastfeeding education for parents during prenatal care and continues through labor, childbirth, and after the baby is born. In fact, one of the first steps towards successful breastfeeding is giving baby to mama as soon as she's born.
We place the baby onto the mom's belly, so then that way mom can start skin to skin right away. When baby is on mom's belly, that helps the baby transition into our world so much easier. They do really well with their vital signs, their glucose levels are amazing, they're able to hold their temperatures. Sometimes babies have a little bit of fluid in their lungs and it helps them clear that a little faster. With skin to skin, we see the babies have a less chance of going to the NICU. So that's something that's pretty awesome. So we try to protect that first hour of moms and babies skin to skin. They can go longer than 1 hour. They don't just have to do 1 hour, but we help to protect that. So the nurses can do some of the measurements and everything that they need while baby is on mom's chest.
Moms are encouraged to breastfeed their infant within the first hour of birth if she's able. Baby stays in the room with mom to allow her to nurse on demand. Staff are on hand to help mom learn the signs of hunger, provide mom with techniques to assist with comfortable, successful breastfeeding outcomes, and provide dad helpful hints too.
Sometimes dads can kind of feel, oh, I don't know what I'm supposed to do or how to help, and it's sometimes just positioning, bringing a pillow, helping the mom make sure she's drinking her water. You want to stay hydrated, of course, but it's just the little things to help them realize, oh, this is my baby too.
The Baby Friendly program also provides support for moms who choose not to breastfeed for whatever reason. Moms and dads learn about best formulas for babies, how to prepare and store them, and how to feed with a bottle. Ultimately, the goal of the Baby Friendly initiative is to provide new babies and their families with time to bond immediately after birth and to get the support they need to begin their new lives together.
They feel more comfortable when they get home. They feel confident that they can take care of this baby, and they understand all the cues, they understand all this stuff. Because if there's something that arises while they're here at the hospital, we have our nurses who have been trained through the Baby Friendly Health Initiative program, and then we have our lactation consultants who are specialists at this, so they help troubleshoot a lot of issues before the moms go home. This is how we give babies the best future possible for them. We're trying to promote a calm environment so then that way they can grow and become the best human that they can. It helps create strong families, especially for our community. This area is big on community, and that's how we start. We start here at the birth.
If you'd like to know more about the baby-friendly practices at San Juan Regional Medical Center, visit sanjuanregional.com. I'm Deborah Uroda for Healthy Living.